Our first speaker is Dr. SATANSHU MATHUR, who will be talking on pre-operative, per-operative and post-operative preventive measures to avoid endophthalmitis. He is the Chief Consultant of High Tech Eye Institute and Laser Center, Kashipur, Uttarakhand.
Hello. Thank you. Thank you, Himatri. We all know we have done a good cataract surgery, but if the end is not well, all is not well. So there are 5 possible factors alone or in combination for this dreaded disease. Personal hygiene, contaminated surgical supplies, faulty sterilization procedures, inadvertent touch and environment. If we can take care of these 5 things, we can have zero endophthalmitis, and that is the aim of my talk, March to Zero Endophthalmitis. What are the preoperative risk factors? We all know, but what happens when we go for the surgery? We forget about it. We are in a hurry to operate. Do not worry what is going on behind the scene. So we should take care. There should be no blepharitis, no conjunctivitis, no lacrimal duct obstruction, and eyelid abnormalities, entropy and etc. should be taken care. If patient diabetes, we should control the diabetes first, then we should operate. And thorough pre-operative clinical assessment of the patient is very important. Investigation, what we should mandatory for do, that is whatever I am going to tell you, it is the AIOS and ESCRS recommendations. You can quote this recommendation in the court of law, you will be saved. Many doctors have been saved by this the guidelines in the court. Blood sugar less than 120, and fasting and random less than 200, you are safe in the court. If above this something wrong happens, then you can be liable for the penalty. Syringing should not be done on the same day, we all know about it. What preoperative medication and instructions should be given to the patients? They should use broad spectrum antibiotics 4 to 6 times a day before surgery if you are doing in the morning, or on the date of surgery if you are doing in the evening. Patient should wear clean clothes, should have male should come with a shave, everything, so that there is hygiene is there. Main important thing is the instruction to the staff. If biometry has to be done on the same day, use immersion method, never do by the contact method. And if you have a list of 10 patients, should operate the diabetic patient first, you should operate the single eye patient first. How to prepare the patient? We should clear the broke region, lid margin, with 10% iodine. We should not clear only the eyelid margin. We should, from the forehead to the up to the nose, we should clean all the area, or this side. Then iodine 5% 2 times topically. 5 minutes before surgery is more important, more useful than using broad spectrum antibiotic a day before surgery. No need to use broad spectrum antibiotic a day before surgery. If you put iodine 5% 2 times before the surgery, 5 minutes before surgery. These are things common. We should use the glove properly ground. Then scrubbing is a very important part. We should have a chart over the scrubbing area, not for you, but for your staff, your assistant, to know that he has to scrub for 5 minutes. I have seen many 100% doctor, I can say, they do not scrub for 5 minutes. Hardly 1 and 2 minutes, and then can go in the OT. Ideally, we should scrub for 4 to 5 minutes and with the proper conditioning with provided iodine liquid scrub. Proper glove technique. Draping is very important. When we are draping, we should give 1 minute time. Normally, draping is done by assistant. So we should train him how to drape. Eyelashes should be not outside but inside the drape, and that's why trimming of lashes is not required nowadays. Monitoring surgical supply. We should check expiry date and packing, whether intact or not, of all supplies which are going to be used in the OT. Check clearly. Main culprit in the infection most cases is the irrigating fluid. So you should always up and down put the bottle and see there is any foreign body, is a particle inside the bottle or not. Ideal is 1 irrigating bottle for 1 patient, but it is not possible in India. So we should use in total 2-3 cases, and then we should avoid it. Nowadays 100 ml bottle are available, so we can dispose it. Phaco sleeve and tip should be changed after each case. If you can do it, it is better. There is little evidence that using antibiotic in irrigating fluid during surgery can reduce the risk of infection, so we have avoided using it nowadays. Subconjunctival antibiotic given at conclusion of surgery have been found to be reduced risk of endophthalmitis. Normally we give gentamicin. Intracameral injection, it is a very long study by Dr. Haripriya in the Arvind Hospital, and they have proved that intracameral injection is very useful. At least in high risk cases, we should always give it. Our incision should be watertight. If it is not watertight, we should not hesitate in putting a suture there. If there is a complication like PC rupture, we should do vitrectomy at any cost. There should be no vitreous tract on the wound area. Installation is very important. High speed autoclave, and then if you do not have high speed autoclave, then you should have adequate number of surgical sets to do this. Autoclaving covered by some other partners, so I am skipping it. Important thing autoclaving, we should maintain the temperature. Not only temperature, but how long it has stand in the right time. It will be covered by other speaker. Then monitoring of the autoclave is very important. So we have different type of sterilizer, physical and chemical and biological indicators. Physical indicator that we put outside the drum, black, that turn the black, this only indicate that you have achieved the required temperature. But it is for the adjustable time that we give 30 minutes, 40 minutes. It has reached, it has stayed there for 30 minutes or not, we are not sure by this physical indicator. So for that, we have chemical indicators, type 5 indicators, we have type, this is color changes, so that we can know that this is a session complete. We have type 6 indicator that also change the color, and we should put these indicators not one but 2 or 3 in the if we are having different boxes inside the autoclave. So this standard tell us that we have achieved 100% installation. This is the most important thing if we want zero endophthalmitis. Biological indicator are also very useful. That is not for the instrument but for the installation of the autoclave we are using. So it should be used once in a month, and then we should keep record of important thing is of we should keep the record of everything. This indicator, whatever you have used, you should put stick on the register with the date and time. That will save you in the court of law. Cleaning of OT is very important. Remove the dust with a clean wetty cloth. OT floor, trolley, that all should be clean. There are different solutions available nowadays for this. Bacillocit is benzalkonium chloride plus ethylene dioxide glutaraldehyde. It can be used for, nowadays we are using D125. This is third generation ammonium compound for surface disinfectant and mopping and fogging. D256 is sixth generation ammonium compound that is also used for the cleaning. The cleaning of OT is very important. We should keep floor clean and do not discard soil linen. Do not flow your gown, everything on the operation theatre floor. Floor should be always very clean. Walls and ceiling are rarely contaminated. They can be cleaned every 15 days. Fumigation of OT is not required nowadays. At least we should not do it carcinogenic. So the solution that we are using, D125 can be used for the mopping and fogging. Cleaning of, ideally this type of AC is not allowed in the OT. But if you are using this type of AC, you should clean the filter of AC once a week daily. Microscope head, phacocorti, they all should be cleaned by chlorhexidine gluconate solution. You can make the solution 10 ml diluted in 5 ml of water and clean the instrument daily. OT layout involvement will be covered by another OT layout will be covered by the other person, so I'm not. But one thing I would like to say, OT should be should be separate from the OPD area, and entry should be restricted in OT area. And culture sensitive from the OT area should be always taken once in a month, and you should keep a record in your book that your OT culture was taken on this date and it was sliced. OT is planned always with the zoning. We have 4 types of zone: protected, clean and slide, covered by the other persons. These are zones. Ventilation is very important. We should have center air conditioning or split AC. Window AC are not allowed. If you have AHU with HEPA filter, it is very good. Laminar airflow should be 20 to 30 cycles per hour. And parameter for OT are temperature 20 to 24 degrees centigrade and humidity 50 to 60 degree. This, water tank is a very, nobody go and see the water tank. Nobody go up on the top of the hospital and see the water tank. But water tank is the most difficult area to treat if there is a contamination. So we should clean once in a month, and we should also keep the record of it in our record, so that we have cleaned. So these are the daily checklist. You can note down who checked perioperative checklist, who checked autoclave, who filled the glove. This should be our checklist, not for doctor but for your staff, that they are aware and they are conscious. We get that checklist signed by our OT staff after the surgery, and that countersigned by me. I never see it, sign it, but they are not aware that I am not seeing it. So they are very punctual about the things. So for the staff, you should have a daily list. These are who did cleaning, mopping before surgery, who cleaned equipments. They should sign it, who is the responsible person. Something wrong happens, he will be held liable for this. Then weekly checklist with the date and time, who admitted autoclave report, who done the cleaning of the instrument or shifting of the instrument. So everything is documented and signed by the nursing staff after the OT and by the consulting doctor. Who cleaned AC instrument, who cleaned instruments, these all things. Then expiry of date of medicine should always be checked before any OT. Whenever we start OT, we shift 5 or 6 viscoelastic, we always check the date of this thing. So all the dates should be checked. There is a monthly checklist. Soft sample culture taken or not taken. IOL stock we check. Date of expiry before opening any IOL. You should check the date of expiry. This case happened in Delhi once, that expired lens was implanted and the chit was given to the patient, and doctor was held responsible for it. So if you take all this care, you will have a smile of this type on your patients. Otherwise, you will have a very anger face of the patient if the end happens. So be careful. You can achieve the zero endophthalmitis. We are getting it for last 3 years, and you can also get it. Thank you.
Thank you very much, Dr. SATANSHU MATHUR.